I am not a physician or a biologist, not an expert in healthcare per se, but I do have experience in information technology and information policy, both areas that I think are very relevant for our discussion today. So, as I said, I'm not a doctor. I don't play one on TV. But I do want to talk about what will happen, what may happen in terms of privacy in the future world that we just heard about. So here's what I'd like to do. I'm going to talk first what my model of this future world is like. This comes from what people who actually know tell me. Then I want to apply to that future world and the question of privacy in it 4 ideas that come from information technology and from technology policy. The idea of connecting the dots, the distinction between possessing data and having permission to use it, the question of data brokers, people who gather, sell, collate information for a living, and finally the idea of the dark net, which is one of the biggest challenges we face. And finally, I'll say just a little bit about the politics of privacy and how that connects to where we're going. Okay, so first, my model of the future world. I'm talking here about a world where we have personalized genomics, meaning that it is a routine thing to sequence the genome of a person. It's a routine medical test and something which is naturally in your healthcare record. Not only are we able to sequence the genomes of individuals, but we know a lot more about what they mean and how to use them to provide personalized care. So you can think of sequencing the genome as a standard medical test, which will naturally have been done. I'm also talking about a world where our medical records and medical histories are stored in electronic form and in a way that is actually accessible and useful, unlike many of the electronic records of today. So again, this information is available to fancier healthcare methods and to information technology and analysis. It's also a world where we have significant amount of data about treatments and outcomes so that we can, again, correlate all of that against what we see. And all of this adds up to very large data sets. You can imagine a notional database of the health history and treatment and outcome for the population of the United States or the developed world, where for each person we have a genome, we have a history of their encounters with the healthcare system. We have a history of what treatments they were given, for what symptoms or conditions, and how it came out. And all of this made accessible for analysis. Now, projecting forward into the future, we see not only those building blocks, but we also see potentially significant advances in connecting genotype to phenotype, in understanding, that is, what a particular genetic marker or feature in the genome tells us about the physical condition of the person who's affected. And of course, those connections run in the opposite direction as well. If genotype implies phenotype, then we can reason backwards as well if we do it carefully. Also, I'm going to assume that we've had significant advances in connecting the information we have from the genome and from the patient's symptoms and medical tests to treatment and treatment outcomes. We'll know a lot, I'm assuming, about how to target medical care at that particular individual based on the information we have about them. This, we hope, will lead to some kind of improvement in the efficacy of healthcare. I hope large. I'll leave that one to the experts. But it certainly will lead to a vast increase in the amount of information that's held in the healthcare system and information that's held about our healthcare and about our genetic state. Both more raw data that is in the system, as well as more information that's been deduced from that raw data. So that's the future world that I'm assuming in talking about the privacy implications. To some extent, what we face in that future is just an extension or maybe a sort of intensification of the healthcare privacy problems we have today. But I'm going to argue that there are some, that what we'll see is more than just more of the same. We'll see, I think, some very different effects starting to happen. And let me get on with that. So the first issue that I want to connect to privacy in this future world is connecting the dots, or in particular, machine learning technologies. We hear this term connecting the dots for the idea that you have a large amount of data which is out there, and you want to find those pieces of data that fit together and that can be linked together to deduce something interesting. We hear discussion of whether the government should have connected the dots in advance of 9/11, for example. Again, the idea, so much data, how can you find the connections that you really need to find? And we've seen, leaving aside the questions about the past, we have seen in the information technology, computer science world, really remarkable advances in the ability to operate on some large data sets and to make really interesting and non-obvious connections. And the way this operates is essentially a set of simple ideas compounded with the brute force power of fast and large computers. We start with a series of dots. The dots will be individual observations, and we move from there to deductions about probability. What is the probability over this population of a certain condition? What's the probability of condition A in this population? What's the probability of condition B given for people who have conditions C and D, and so on? So there are many different dots, many different data points or questions we could ask. What we need to know is which ones should we ask and how should we fit them together to get something that's really useful and interesting. And there's been tremendous advances, really, in doing this. You might think that this is sort of a straightforward process, but in fact, when you apply it on a very large scale and consider long chains of inference, you can get some really startling results. And we see these every day. Anytime you search the web and you get a result suggested to you, this is the page you probably want. That's essentially the result of a machine learning process. But it goes further than that. There have been really interesting results in, for example, language translation. You might think that if you wanted to translate Arabic into English using a computer algorithm, that the best way to do it was to teach a computer about Arabic, to teach it about English, to teach it the syntax and semantics of the language, some idioms, maybe some cultural features about the use of the language, and to try to do translation in the way that people do translation. But in fact, the very best method for translating Arabic into English by computer is simply to take an enormous corpus of documents which are available to you both in Arabic and English. Who has those? Well, Google has them. There are many web pages in the world that are available in both languages. And to just point a relatively dumb machine learning engine at this and tell it to figure out what's the relation between this body of stuff and that body of stuff. And the result outperforms any other method for translating Arabic to English. Quite a remarkable result. And we see lots of other examples like this. Computers learning to play chess better than the best human, despite knowing almost nothing about chess. We see again and again that brute force applied to large data sets with a fairly simple method can get you really remarkable results, and something that, if we didn't know better, looks like understanding. In fact, though, when we try to take the results of these methods and explain them, we find that we can't. Because if the computers are thinking like Martians, we're trying to take Martian philosophy and translate it into Earth thinking. It just kind of doesn't work. So we can expect that these methods applied to healthcare data with enough ingenuity and effort will give us ways to make connections that we couldn't have made ourselves. We couldn't have made unaided connections that are surprising and that we don't even necessarily understand how they were made. And yet, I believe that we will be able to make connections between genes and behavior, between genes and treatment, between genotype and phenotype in very indirect ways. Now, put together with that, the fact that there are a lot of correlations in genetic data. In particular, the fact that your genome is strongly correlated with those of your relatives. That means, for example, that if you want to know about my genome, you don't need to talk to me. You can sequence my wife's genome and my daughter's genome and my brother's genome, do some analysis, you'll know most of my genome. Now, if I tell you in addition that I'm 6 feet 2 inches tall and have brown hair and am allergic to cats, maybe that fills in the other information you need to figure out exactly which gene I got from the parent, from my parent, instead of which other gene. My point is that these things are strongly correlated, and the impact of looking at a particular individual extends beyond that individual and extends out sort of through the web of relationships. So we have large data sets. We have many correlations from genotype to phenotype. We can reason from genotype to phenotype. We can reason from phenotype to genotype. We can reason from my genotype to my relative's genotype and apply the computers of 20, 30 years from now to all of that, along with sophisticated machine learning methods. And you have a very powerful ability to make connections and to figure out things about people based on very little information that you collected directly from them. All of this, so more dots, the ability to connect the dots further, and you have a situation where the raw data on which all of this is built, it becomes very, very powerful. And this creates a strong appetite to collect the data and to analyze it and operate on it. People want to collect the data, they want to own the data. You want to be the one who holds this database. Which brings us to the next idea that I want to talk about, the choice between, or distinction between possession and permission. And to talk about this, I want to tell a hypothetical story. 20 years from now, I'm traveling in rural Tennessee, and I cut my hand. I have to go to the small town doctor to get my hand sewed up. Naturally, the doctor wants to not only sew my hand up, but to protect me against the possibility of infection. And this being the era of personalized health care, that treatment or prevention against infection will be personalized to me based on my personal characteristics, my health history, and also my genome. The doctor would like the doctor says, I'd like your genome, I'd like your DNA, because I want to run an analysis to figure out exactly what treatment to give you to prevent infection. Now, I certainly have no interest in having an infection, but I just met this doctor, and I'm never going to see this doctor again, and I'm well aware that my genome reveals a lot of information about me in this future world. So I'm not so eager to give this doctor my genetic information and let him do as he will. And so we compromise. The compromise is I will let the doctor ask a few questions about my genome, which I will answer, but I'm not going to hand the whole thing over. We've come, if I'm really careful, if I'm really distrustful perhaps, I'm going to insist that those questions that he asks about my genome are questions that have been recommended or vetted or approved somehow by the American Medical Association, by my health insurer, or by some kind of expert. In other words, I'm not going to give the doctor my genome. I'm not even necessarily going to give him carte blanche to ask questions or query my genome. I'm going to give limited permission for him to do just what he needs to do. Don't give possession of the data, just give permission to query the data. This applies, of course, in all kinds of other situations. Researchers would like to be able to crawl over the genetic data, the treatment data, and outcome data for everyone in the United States, everyone in the developed world, but the members of the public are not necessarily interested in giving that data to anyone who happens to be a professor of medicine or an employee of a big healthcare company. Researchers, again, may have permission to query data in particular ways. They may have to negotiate for that rather than having access to or ownership of the data. Insurance companies, healthcare providers, cost managers, again, are likely to have limited permissions, and you can expect a lot of negotiation about the exact terms and conditions. What questions can they ask? What can they do with the results? And so on. Again, for public health, government wants, for public health reasons, to know what's going on. And again, you have choices to make. What kinds of queries to allow, because people will not be eager to hand over all of this information when the information is so powerful. And so although it is tempting to look at this as a question of ownership, who's going to own the data, who's going to have the data, it's really more fruitful, I think, and more and a better match to what's likely to happen to ask questions about permission. Not who owns the data, but who has which rights, who has which abilities, who has which permissions, and who has which obligations with respect to the data. Because certainly if I give my data to that doctor, I'm going to insist that he accept certain obligations with respect to it, not to use it in certain ways, not to keep it beyond a certain date and time, and so on. Now, of course, this distinction between possession and permission is something that we can try to finesse, which we have over the years when we talk about anonymizing data or scrubbing data to take out personal identifiers. This is something we do all the time when we have limited data sets. We want to be able to scrub out the personal identifying information so that the data can be given to researchers, public health officials, and so on, so that they can do what they need to do, but without endangering the privacy of the individuals. Well, this becomes much harder to do in an era where there is so much data, and we have such a powerful ability to reason from that data to other facts about the individual. If the researchers or the public health officials don't know what they're looking for in the genome, and when you use machine learning, advanced machine learning methods, you often have no idea what you're looking for. All you know is you're going to throw this data into the hopper and turn the crank, and the machine will find some kind of connection for you. Well, if you don't know exactly what you're looking for, and the data turns out to be very valuable, it's hard to figure out how to anonymize it. It's hard to figure out how to take out the part you don't need without and really take out anything at all. The genome is both the most valuable medical data and also the most personal of personal information. And I think it's very difficult to square that circle and think about how you can anonymize it. And so we're stuck, I think, with the very difficult problem of negotiating the terms and conditions under which people can access genetic and medical data. This is a problem on which information technologists are just starting to work, but I think we have a long way to go before we can do much that's really useful. The anonymization or scrubbing methods of the past really, I think, don't cut it anymore. Now, the third idea I want to bring in is the role of data brokers. And this is a topic in which we have a lot of experience, not all of it pleasant, in the current privacy wars. Not so much in the medical field as in privacy with respect to commercial data. All of us engage in commercial transactions all the time. Whenever we buy something with a credit card or a debit card, whenever we use a frequent flyer, frequent buyer, discount card, electronic coupon, or any of that, we're leaving a trail. And there's a very strong commercial drive to gather and exploit that data, which has led to the rise of large data brokers. Probably the best known data broker of this type is a company called ChoicePoint, which managed to stay below the radar for a long time, but has lately gotten into the news. And their business model is pretty simple. They're going to buy or gather all the data they can about these commercial transactions, and they're going to sell it, in theory, to those who need to know, but in practice to those who are willing to pay. And this is something that will be increasingly in demand with respect to data of interest for healthcare. Now, healthcare data per se is, of course, subject to its own set of privacy rules, but as we get better at connecting genotype to phenotype, that is, at connecting the genome, which is basically medical or healthcare information, to behavior and preferences in the real world, information that wasn't even gathered in the healthcare setting becomes useful and valuable and interesting for making deductions about things that are of healthcare relevance. And so it becomes more difficult, I think, to draw the line between personal information that relates to healthcare and that which doesn't. And so if for purely commercial data we saw this rise of information gathering, it's certainly something that's very plausible for information relevant to healthcare. You could imagine even attempts to gather, in whatever way it's lawful, genomic data about individuals, to collate it, to sell it, to provide a sort of genetic credit rating to individuals, for individuals, just as we see with companies like ChoicePoint. Now, we're going to see some discussion of this. We're going to see people move toward this direction, limited by the healthcare privacy laws we have. But I think fears of this kind of behavior are going to drive a desire for regulation in this area. A desire for regulation which will surely be needed with respect to people who are gathering healthcare and healthcare relevant information for the wrong reason, but which may cause a lot of collateral damage to those who are trying to help. Nonetheless, there are limits to the effectiveness of even the best and most effective regulation we can have in this area, which brings me to the fourth idea of the darknet. Now, this is an idea that came out of the fights over digital copyright and over the control of information of that sort. And we know how that story goes. That technology, information technology, has made it much cheaper to store, gather, transmit, and analyze information. It's put the tools to do all of those things into the hands of individuals. And as individuals got the ability to do those things, they started doing it. Information wants to be free, as the saying goes. And I'm not sure what information itself actually wants, but we know that people want to know things. They want to gather information, especially about other people, and they want to pass it around. That's one of the most basic human urges. And when you put these powerful human desires to know things about people, especially neighbors, especially famous people, together with powerful technologies, what you get is a situation where information will be gathered and will be stored. And this, in the world of copyright, of intellectual property, has happened with a vengeance. Every effort to use regulation and legal prohibitions to stop this has been basically fruitless. We've seen, for example, in recent years, a growth not only in the sharing of copyrighted material, a growth in the sharing of classified material from government files. We see information being published, and governments and regulators really unable to suppress it, no matter how strong the interest in doing so has been. In many parts of the world, this has been a very positive trend, but there are some cases where it's done a lot of harm. We've also seen attempts to use technology to fight the spread and sharing of information also fail. And ultimately, we've had to rely on personal responsibility, which works sometimes. Now, when you think about the value and the personal nature of the genetic and healthcare information, and you put that together with the idea of the darknet, that any individual who wants to will be able to publish and spread and analyze this information, I think you get to a really interesting spot. There's no doubt that in this future world, every one of the presidential candidates, every prominent politician, every celebrity would have had their DNA captured by somebody somehow by the genetic paparazzi trying to get hold of a little bit of something. And there are, of course, many ways to do this. It would be impossible for a person to maintain their own genetic information close and hold it closely. To the extent that we can perform medical tests cheaply on small amounts of tissues, on small amounts of blood or saliva, that is also something that could easily be done to a prominent person. And again, there would be not much that could be done by law or regulation or technology to stop this. And so you would see on the internet if we were in that future world now, you would see a detailed comparison of the relative merits of Hillary Clinton's genome against Barack Obama's genome, and whether the Republicans or the Democrats tended to have stronger genes indicative of leadership, and all of that. Extending as well to celebrities, but finally to really to all of us. The natural desire to know about our neighbors is very strong. And as this technology spreads, it becomes very difficult to stop. And that puts us into an interesting spot in terms of trying to understand how to regulate or control the use and spread of this information. We not only have to walk the tightrope between trying to differentiate those uses that are beneficial from those that are not, we also have to cope with the fact that whatever we say, whatever we try to prevent, we may be able to deter organizations, but we're unlikely to deter individuals from doing what they want with genetic information and medical information. And that I think is a feature of the future that we are just going to have to get used to. Now, of course, all of these ideas connect together. These are themselves dots that can be connected. The ability to analyze genetic data, to connect the dots, to reason from person to person, for example, applies just as well to the presidential candidate, to the celebrity, to the neighbor. I don't need to get the senator's DNA. I can get the senator's cousin's DNA, the senator's spouse's and child's DNA, and reason from there. I can observe that the senator, I can observe the physical characteristics of the senator and reason from there, and so on. A lot of information becomes available about all of us, which really, in many ways, does intensify the privacy questions that we face. Which brings me to the last piece of this, which is the politics of privacy. This is a topic on which not only the political system, but also the public has really been, I think, deeply confused and ambivalent. And there are really two paradoxes that we see in privacy politics. The first is the disconnect between what members of the public say and what they do when it comes to privacy. If you ask people, do you care about privacy? Do you care who knows this information about you? They say, oh yes, we care very much. This is important. People say privacy is important, but they act like privacy is not important. The same people who said, I don't want anyone to know what I eat. I don't want anyone to know where I shop, will in fact happily give away all of that information to the large grocery store chain in exchange for a 1% discount. We'll tell it often to a person who calls up and says, I'm doing a survey. People say that privacy is important, but they trade it away for almost nothing. And this leads to, and this connects to the second sort of paradox that we see in privacy politics, and that is the tendency of the pendulum to swing back and forth rapidly on the privacy point. Privacy policy in the U.S. compared to other places, and I think also by an absolute standard, has been relatively laissez-faire to leave information alone. Generally speaking, we're not allowed to intrude into other people's spaces to gather information about them, but whatever they reveal, except for some limited exceptions, of which the rules in healthcare have been different to some extent, but still, for the most part, the policy has been primarily a laissez-faire. What people reveal can be shared, can be reported, can be used. On the other hand, we have these occasional eruptions of backlash, where people push back against particular incidents. Either the public gets angry about something, leading to a sort of point law being passed, or political officials become upset about something. My favorite example here is the law about video rental records privacy. Some of you maybe have heard this story. So when Robert Bork was nominated to the Supreme Court, an enterprising reporter went to the video store in Judge Bork's neighborhood and convinced a clerk to hand over the records of what videos Judge Bork had rented, and proceeded to publish this information in a local paper or magazine in Washington. And so the public could exercise its right to know that Judge Bork liked to watch Westerns and Disney movies. Probably not what the reporter had hoped to find. But in the wake of this, members of Congress got very concerned about video rental records, perhaps thinking of their own records. And so we have a law, one of these localized backlashes, that says that video stores may not reveal rental records. And so what we have had is on the one hand, occasional eruptions of concern and small, localized instances of control or regulation. What we have not had really is a global picture, a global look at our privacy policy to understand what's going on, what makes sense, how can we possibly do this and that together, what are we trying to achieve, and so on. This has really not happened. We have not resolved these paradoxes. Whenever a privacy issue comes up, it seems to get entangled in grandstanding and to spin off, to be resolved by compromise and localized negotiation that nobody likes but everyone can live with. But as we push into this future of personalized genomics and personalized healthcare, these privacy problems are going to take on a different order. And we're not going to be able to get by, I think, anymore with the kind of ad hoc approach to privacy and privacy policy that we have used so far. The time to start answering these questions is not when this technology is upon us and these things are happening. The time to start answering these questions and figuring out what we want to do as a society about privacy, and especially healthcare privacy, is right away. Personalized genomics and personalized healthcare are going to force us to make those choices, but we need to make them before we get into trouble, because every time we've reacted in privacy policy, we have tended to make bad decisions. Thus far, we've really not made choices about privacy policy, and to not choose, in this case, is really to choose incoherence, and in many respects, to choose the worst of both alternatives. The good news is that people are starting to talk about this problem, and events like this are a helpful sign. We're not waiting for this future healthcare world to come upon us, but we're trying to figure out what it's going to do to us and how we can respond. I'm eager to join the other panelists and have a vigorous discussion after the break. I'm really looking forward to the rest of this afternoon. Thank you.